This episode is brought to you by Banfield Pet Hospital and proudly sponsored by our friends at Zoetis. Zoetis has over 70 years of experience in advancing animal health through a range of medicines, treatments, and diagnostics to help pets live their best lives.
Your call has been forwarded to an automatic voice message system.
Hannah Shaw
Is not available. At the tone, please record your message.
Hey Hannah, this is Brittany from Toronto, and I am picking up my very first puppy this weekend. I'm super excited, but really nervous. There is just so much information out there, and I just don't really want to mess anything up. So, what are the most important things I should be doing in the first few weeks of me having my puppy, and where do I even start?
People call me the kitten lady, but the truth is I also care for a lot of puppies. My husband and I have fostered dozens of neonatal puppies, from pugs to pitties, and it is so much fun to watch them grow from newborns and eventually find their adoptive families. But what is it actually like for those adoptive families who bring them home? How do you bring a new puppy into your home and make it a successful transition for everyone? That is the subject of today's episode, Puppy 101. And if you just brought home your new friend, this is the crash course that you have been waiting for. From the first vet visit to nutrition, vaccines, and red flags to watch out for, consider this your puppy care syllabus. Today, I'm joined by Dr. Jennica McGuire. She's a veterinarian and chief of staff at Banfield Pet Hospital. Based in Brentwood, Tennessee, Dr. Jennica brings nearly a decade of hands-on experience and is passionate about preventive care, mentorship, and supporting both pets and people throughout every stage of life. Dr. Jennica, welcome to the show.
Thank you. I'm excited to be here. Glad to be joining you.
So today we are talking about puppies, and I wanted to start by asking, was there a first puppy in your life?
Yeah, so the one that sticks out to me is my own. Her name is Bella, and I got her my second year of college, which was funny looking back that my parents gifted me a puppy at such a young age. But she is going to be turning 17 in October. And so she's really been with me my entire adult life, and is a big reason I'm so passionate about veterinary medicine because my dogs are my family. So I really relate to my clients in that way, and really allows me to always give my all for my clients and my patients.
Oh, 17 years is amazing. I love that. So let's start at the beginning of puppyhood. So if somebody told you, I'm going to be bringing home a new puppy in a couple of days, what would you tell them about preparing for that? What do they need to do in advance? And then how would you frame the right approach to those first 24 to 72 hours together?
I'd really make sure they had what I would consider the basics. So I like for them to have a water bowl, a food bowl. You want to have a leash. I'm a big proponent of harnesses, a collar, some form of identification. Um, I do talk a lot with my clients about kennel or crate training. So, to have a crate that is big enough that they can stand up in and turn around. So, I love the ones that can kind of adjust according to their size and grow with the puppy as it ages. You want to have some bedding, some toys that they can play with. I'm a big proponent of some pheromone products just to help that transition. And they'll want to get some puppy food according to, the puppy's breed and things like that and their sizing. So in that first, 2 to 3 days, really just, trying to take the time to spend with the puppy and helping that new member of the family get used to being at home. This is a new place for them, so it can be a little bit overwhelming. But, trying to encourage the owners doing at a time in their schedule when they can spend a lot of time there, to make that transition as easy as possible, really for everybody.
Yeah, I totally agree with that. I foster puppies sometimes, and I always recommend if you have the weekend off, come pick them up on Friday so that you get maximum time just together during those first days. What should a puppy's daily routine actually look like in the beginning, and how can people start to establish a good routine that is going to carry through the rest of their life?
Well, I think what you said is like imperative routine, right? Like we want to set something up that the puppy finds approachable and that we can do every day. So, um, what I really like to do with puppies is, right when I wake up in the morning, take the puppy out, and that they get used to that. And then they're offered food first thing in the morning. And then right after they eat, they go outside again, right? So that we get in that routine of potty training. I love for my, clients to be able to offer like frequent meals. For a puppy, ideally 3 times a day is going to be great. That doesn't work for everyone's schedule. So at least twice a day is ideal. And then we want to build in some time for play, some time for some socialization, maybe some outdoor walks and activity, but really trying to stick to a similar cadence every day, even on the weekends and things like that when we're off. I think will help that training and help them get settled in.
Hmm. Now, puppies can obviously come from a lot of different backgrounds in terms of what vet care they've received. Maybe they come from a shelter or rescue that has already given them a couple vaccines or deworming, or maybe they have had no vet care at all. So, what would you recommend to people to ask when they're bringing home their new puppy? What questions should they ask? What records should they get? And what do they need to know to bring to you for their first puppy appointment?
Yeah, I think, having the conversation with whoever you're getting it from, any vaccine records are key. I like to know whether they were given at a veterinarian hospital or given by like the breeder, for example, because it does mean something different to me. I like to know the age that they had those vaccines at, and if they've been seen by a veterinarian, like what did that first medical exam look like? Were there any, you know, abnormalities that we like need to follow up on. I also like to know like nutrition wise, like what we've been on, and if they've been growing up like quote unquote normally. Is there anything like we need to follow up with at that first visit, that we need to track as they grow into adulthood?
Yeah. And, even if they have seen a vet before, I always tell every adopter you need to establish care with your new veterinarian. Can you talk about why do they still need to come in for a new puppy appointment and what can they expect to happen at that appointment?
For me as a doctor, when I can see that puppy straight out of the gate, I'm a better doctor. I'm able to provide better care, more consistent care. And, there are certain vaccines that we want for them to continue to have boosters, until they're in those like later puppy ages. So, as an example, I really want that last distemper parvo to fall somewhere between 17 and 20 weeks. And then after that, we start preparing for like our spay and our neuter and all of those type of things. So, I think, I ideally want to see that puppy within the first 24 to 48 hours, if not, within that first week. But we're also going to do some routine testing to make sure we're not bringing home any, intestinal parasites, or things like that. So just really want to jumpstart all of their prevention straight out of the gate.
Sure. Yeah. And you make a very good point that, prevention isn't something that just happens at one point in time. When these puppies are in care prior to coming home with you, maybe they've had something, but chances are they still need, to have some boosters. Can you talk about that kind of preventive care schedule? What does that look like?
Yeah. So usually, as I spoke, like the distemper parvo vaccine, we'll booster that. I usually start at around 8 to 10 weeks, depending on when I first see the puppy. We'll booster that every 3 to 4 weeks until like I said, they're somewhere between that 17 and 20 weeks. I like to do the rabies somewhere between 14 and 16 weeks, so around 4 months. The Bordetella vaccine, which is like our kennel cough upper respiratory vaccine, we'll usually do at their first visit, and then leptospirosis is something that is now moving kind of into our core vaccine recommendation. So I'll usually start that at around 11 to 12 weeks, just depending on the size of the puppy, and we'll booster that as well. So I really like, before they're 20 weeks old, to have all four of those vaccines in that time. And that's just the first part of it. We're also going to routinely deworm these guys. We're going to routinely check intestinal fecal exams to check for those intestinal worms. And then the last piece of the puzzle, which I also think is one of the most important parts, is an oral monthly preventative. So I really want to start them on heartworm and flea and tick prevention straight out of the gate. And heartworm prevention is something that can be started as young as 8 weeks old, and I want them on it the rest of their life, because prevention is the way to go, really with all of those things.
You talked about vaccination a lot, and one thing that adopters have sometimes been surprised by when I am introducing them to their new puppy is that until they're fully vaccinated, it's not really a good idea to be bringing them to places like the dog
Yeah,
park. And I
sure.
find myself doing a lot of educating of new adopters with that. Can you talk about that? Like, why can't a person bring an 8-week-old puppy to the dog park?
I think that there's just a lot of scary diseases out there that puppies can get. They're going to be more immunocompromised. And so they're not going to, when they don't have that full vaccine series in them yet, and they don't have mom's maternal antibodies fully protecting them at that point, it's, always going to be best that, I call it no new friends. So we're not making any new friends during that time period. But for me, like distemper virus and parvovirus are, not just something that can make them ill and not feel good for a short amount of time. It's something that they can unfortunately pass away from. And so I think that there's other ways to socialize without going to dog parks and, these large areas where we're unsure of everyone's vaccine schedule and records. But we want to just err on the side of caution until they're fully vaccinated. And then they can make all the new friends they want.
Yeah, I really appreciate that. And I think maybe people don't realize how fragile puppies are and how fast things can go downhill. Can you talk about early signs that something might be wrong, especially subtle
Yeah.
signs? Are there things that
Yeah.
maybe would seem normal to a new puppy caregiver, but that would make you raise an eyebrow?
I think for me, like anytime a puppy is not eating well, that's always a red flag, especially if they've eaten every single meal prior really well. So even the missing one meal would raise an eyebrow. Two would be a red flag to me. Big bellies, like big distended bellies, they could just be like, oh, they ate well. That could be a sign of intestinal parasites. I think, we'll even see pale gums. I have my owners like look out for that as well. But, even stuff just like shaking their head can actually be signs of an ear infection, which can be really painful. And so, what I always tell my clients is if you're concerned, I'm concerned. So, I'd always rather take a look than, wait too long.
Yeah, I really agree with that. If you see something that seems off, just speak up.
Yep,
Let's talk
exactly.
about nutrition. I think that when people are going to the store to buy some dog food for their new puppy, they might be surprised to see all these different options and there's life stage options. Why is it important to buy your puppy food that is made for puppies as opposed to for adults?
Yeah, I mean, it's overwhelming, right? Like you walk in there, I get overwhelmed. And owners are always asking me like, what food should I feed my dog? And, unfortunately, like I haven't read a paper on every single food that's out there, right? It's impossible. But we want to feed puppies puppy food, and ideally puppy food that's based off of how large they're going to be. So if you have a Great Dane, it probably doesn't need to eat the same type of puppy food that a Chihuahua needs to eat. But the big thing is it's going to have different, from a puppy to adult to even like a senior food. There's going to be, different calorie counts, different fat, carb, concentrations in there, different minerals and things like that that can encourage them to grow. So like calcium and phosphorus levels are going to be different in a puppy diet versus an adult food. Really until they're, and of course it depends on the size of the dog, but until they're, 10 to 14 months old, really want them on that puppy food. But it's important to customize it based off of your kiddo as well, but puppy food all the way.
I want to move on to puppy behavior. So let's talk about puppy energy. Whenever I foster puppies, I feel like I'm like, oh, yeah, I remember this. They're very chaotic. They have like constant zoomies. How do you recommend that people deal with that level of energy in a puppy?
Yeah. Yeah, I always like call it running around like a nut, you know? So I think the first thing is like to signpost to my clients, like, that's normal. So, like, in some ways that's what we want. It means they're probably healthy, as long as they're doing everything else. But I think, they're going to run around like a nut and then they're going to like take one heck of a snooze. Right. So I think the important thing is, to make sure that they're getting, their full meals, to make sure that we're carving out specific time to play with a puppy, to mentally stimulate them. I think exercise is really important during this time as well. So just because we can't go to the dog park doesn't mean we can't take a walk down the block that's, mainly on, the sidewalk, as long as it's, not too warm outside, as an example. But I think making time to spend with them so that they're not just running around like a crazy pants, but they're, we're also taking some focused time to teach them some tricks to, get their noggin going, I think can really be helpful. And then we can teach them the things we want them to learn in the long run anyways.
Yeah, I'm glad that you said the energy is normal because I actually think sometimes people might not realize that that's a positive thing. I always tell people puppies have two modes. They're on or they're off. And when they're off, they're like snoring. And when they're on, they're pretty wild. But let's talk about the other end of that spectrum. Like if your puppy is very sleepy, does not have a lot of energy, what could that mean?
Once in a blue moon, that could certainly be a puppy's normal. But I think in general, I'd want to dig into that a little bit further. I would want to make sure that we don't have some intestinal parasites. I'd want to make sure that we don't have some other disease process, that we don't have a congenital abnormality that may have been missed. So, just because that very first puppy visit, they got a clean bill of health doesn't mean that things can't change. And I think it's important to be in tune to like, what is my puppy's normal? And if we're not doing our normal thing, that should be like a ring a ding. Like I need to follow up with my vet. I need to have my puppy seen. Because again, things can change a little bit faster in puppies. And as you referenced earlier, can go downhill a little bit faster. And so that's something I'd want them to be seen about if it persists for more than like half to a full day.
Yeah, I appreciate that. In both puppies and kittens, lethargy is one of my biggest red flags that I tell people like don't wait and hope that it resolves. If you see something that seems really abnormal, that's for me like a same day issue.
Yep, I agree.
So are there any habits that puppies start forming that people tend to overlook that you kind of think this is something you should be addressing as it's beginning?
Yeah, I think for me, like the big one that stands out is this like play biting thing that, every puppy does. And like, then we're like playing with them with our hands and their face and things like that. And it's really cute when they're 8 weeks old and 10 weeks old and 12 weeks old. But then I think we become confused when they're still doing similar activities when they're older. And they may not always be able to read the room as to who they're doing that with. So they may be doing that with strangers. They may be doing that with young children. They may be doing it to other dogs or cats or, whatever. So I think that really trying to not to promote playing with biting in that way, and really promoting play through a different type of way, I think is really the way to go there.
Yeah, there's like a certain phase when puppies just are putting their mouth on everything. I know that my husband and I have lost a lot of our shoes to puppies and
Yes.
RIP shoes. So sad. Now we know
Yes.
when we foster puppies, the shoes cannot be out. But what are they actually doing when they're having that behavior? Like, why is biting such a common thing for puppies?
I mean, I think it's just a way that they like can express like their playfulness and, their affinity for their owner, like I want to play with you, and, typically when puppies grow up, they're going to do some of that with their siblings when they're really young. And so it's probably just a little bit of carryover. But I do think that it's something that, we need to try to nip in the bud early if we can. But again, I never want my clients to not play with the puppies. We just need to do so in a different way.
Yeah. Are there things that you would say to not do in response to those types of behaviors? Like, are there things that people do that you're like, oh, that's not really the right approach?
I'm one that I think that I never like to give something negative. And so what I mean by that is I'm not, you know, no, like a firm no is about as like far as I'll go is like giving something negative. I think puppies always respond better to taking away something positive. So my puppy that's, wanting to play, all they want is my attention, right? So if they're doing something that, I want to either redirect, I'll do so with like a different toy, or I'll take away my attention. So, if we're playing in the floor and we do something that, I don't want them to do and I don't want to promote, I'll just stand up and walk away and take away that positive attention. Or I walk through the door, my puppy's jumping up on me. I'm going to turn my back or just stand there still until they sit down and then I will address them.
Mm. On the subject of biting things, can we talk about teeth? I am curious, usually with dogs and teeth, we're hearing about kind of dogs coming in for their dentals when they're a little bit older, but are there things we can do to help puppies have good dental habits?
Absolutely. I definitely think that just as prevention with vaccines and heartworm prevention start when they're really young, so does dental prevention. And I actually like for, the puppies that I see during that second year of life, I do recommend them getting a dental cleaning under anesthesia so we can get a good oral exam and, get some dental x-rays, make sure everything's healthy. But when they're puppies and those teeth are growing in and everything, I think one of the things that my clients can do is just socialize our puppies to them having something around their mouth. And that is going to then transition into us being able to brush their teeth. So, the best thing that my clients can do is for their pet to have a dental cleaning annually. But number two, right behind that, is them brushing their dog's teeth at home. Ideally, 2 to 3 times a week. Bonus points if you do it more often than that. But I think getting them used to that, I think is ideal. The second piece of it for me is we need to introduce things to chew on that are healthy for their teeth. And what I mean by that is I never want a puppy chewing on something that's harder than the enamel of their teeth, because when they're puppies, but also as they grow into adulthood, that can cause them to fracture some of their teeth, which can cause infection and then require therapy, whether it's extraction or a root canal. So what I tell my clients is I like to use my fingernail. And if there is give underneath my fingernail for whatever toy I'm offering, then there'll be give underneath the enamel of the tooth. So it should be safe for them to chew on.
Before we wrap up, I am just wanting to hear from you. Is there one piece of advice that you find yourself giving over and over again to people with their puppies?
So I just really want my clients, and anyone that's getting a puppy to give themselves some grace. I want them to know like there's going to probably be some hard nights, there might be some frustrating days, but it's one of the best things that you'll ever do bringing a puppy home, and to let them know like not they're not going to do everything perfectly right, but that it's going to be the best thing that you ever do.
I love that. Okay, so time for a little fun. We have a segment called Off the Leash. This is your chance to share like a surprising hot take, something that is maybe an opinion you have that would make other people go, oh, really? Do you have a hot take with puppies?
I do. And it's just, we don't have to give in to every single thing to our puppies. So every cry, every whine, every sad eyes doesn't always require attention. I think it's important that, puppies learn how to self soothe. I think it's important that they, learn what our expectations are our households, and that's different for everyone, right? But we can definitely promote some not favorable activities if we give into every single little thing. So, while it's hard for me too, I got a new puppy 2.5 years ago. I found myself even having to hold back because he's got little, Shih Tzu eyes looking up at you. The sweetest thing ever. But it's all about the long game.
I love that. Don't let your puppy control your mind fully. They do have a way about them that is incredibly difficult to not give into. But thank you for that hot take. I agree with you for the record. And thank you so much, Dr. Jennica, for your time today.
Yeah, of course. It's been great. Thank you for having me.
And that wraps today's Puppy 101 lesson. From setting up strong routines to tackling teething, we've learned that a little preparation goes a long way in raising a healthy and happy pup. My number one lesson is definitely to give yourself some grace. This is a messy and magical moment, and together you're building the trust and joy that will grow into a beautiful lifelong bond. Thank you so much to Dr. Jennica McGuire for being our guest professor today. Class is dismissed until next time.